Hi, I'm Dr. Tony Salamay. I'm a doctor of chiropractic. My focus is in neurology, functional neurology, and I'm also a nutritionist. Basically, what we're going to be talking about today is a condition that we often hear is ADD or ADHD. And what that stands for is attention deficit disorder or attention deficit hyperactivity disorder. And what this is typically a child that's diagnosed with ADD is usually taken to the psychiatrist, psychologist, and they're diagnosed based on the criteria. They can't accomplish tasks and they're not able to finish them. They can't tend to focus. So what these kids are going through is they do have, the condition is real, and they do have these short attention spans. They can't particularly focus, and it's not that has nothing to do with their cognitive ability or their intelligence or their IQ levels. Often we find that they have very high IQ levels, but they're just not able to sit down and concentrate and focus. And I'm sure that if you're a parent who has a child has ADHD, and I'm sure that you've already know this information and have gone through that, many of these kids are heavily medicated. And a few medications that they use is, one of them is Ritalin, and another one is Adderall. And these medications have serious side effects, and these side effects, to name a few, you get abdominal pain, stunted growth, heart palpitations, angina, insomnia, problems with sleep because they're overwired, they're overstimulated. And basically what these drugs do is they just stimulate the whole brain. Now, it's important to find out where is their problem first. And I always talk about finding the root cause of the problem, and the way to assess where the root cause of the problem is to find out what's causing the dysfunction. First of all, let's look into ADHD and see what is wrong with these kids with their neurological function that are causing this disorder. Okay, so first of all, let's understand the basic brain function to understand a little bit more about ADD, ADHD. In the brain, we have lobes. We have the frontal lobes, we have the parietal lobes, we have the occipital lobe, and we have the temporal lobes. Now, in ADHD, the major issue with these kids is their frontal lobes are not being properly the wiring to them is not proper, so they're not getting a strong enough signal or strong enough stimulation to the frontal lobe area. The reason why is that the frontal lobe is not only associated with thinking and calculation, but has to deal with focus and concentration. So what happens is the brain and other areas are overwired, overstimulated, and what happens is they're not getting enough of that stimulation, so the brain is not balanced. When the brain is not balanced, that's where you start finding that these kids are just not able to continue to concentrate. So they may end up doing a math problem, and they're doing really well, and they get that, and they can calculate, but then they've got 5, 6, 7, 8 steps. As they get older and they start doing algebra, now they have more steps, and they're not able to. They're coming up. Their final outcome is coming out wrong because somewhere along the line they're losing their focus within the steps, and they're not accomplishing it because they're not able to focus on the problem. So their grades are maybe suffering as a result of that because their concentration areas in their brain are not being stimulated properly. So with that in mind, with them taking the medication, although it stimulates that frontal part of the brain, it actually stimulates the whole brain. So other areas that are already hyperactive or unbalanced, it creates hyperactivity in all the other lobes of the brain. That's a problem because what happens is now you're getting overstimulation. Now you're having overstimulation in the parietal lobes or the temporal lobes or occipital lobes, and it's creating hyperactivity. It's creating impulsive behavior, and it's a whole problem. So with these medications, they're causing serious side effects. In some kids, they're having heart arrhythmias or irregularities, and it's continue to just mask the problem. It's not fixing the cause of their problem. So what we do in functional neurology is different. Our focus is to figure out what part of the brain is overstimulated, what part is understimulated, and let's actually treat that problem, treat their problem, and figure out how to get the proper stimulation and proper inhibition or slowing down of other areas that are hyperactive and get the brain in complete harmony and balance. And the way we do that is through specific, and I mean specific, neurological chiropractic adjustments targeted to certain brain areas for either stimulation or inhibition. Another thing is we may use heat and ice therapy. We may use electric therapy, very light, very gentle electric therapy to stimulate certain areas of the areas of the body, which will in turn affect the brain, or areas in the actually that will affect the brain. We may use auditory stimulation in one ear to stimulate one side of the brain if one side of the brain is dominant and one side is deficient. So there may be there could be a lot of variations within that person, and each person with ADD may be different than the other patient. So another kid may have ADD, or even if it doesn't necessarily have to be a child, it can be an older person that has ADHD, and they continue to have that, and it's not being addressed with them. So our focus is to address what's going on in the circuitry of the brain and find out how to create proper and optimal balance through establishing the proper adjustments and treatments through functional neurology, and looking at them on a biochemical level, because there may be biochemical things such as heavy metals or chemicals that are in their body. There may be some food sensitivities that they may have, and it can create that disturbance and create that imbalance in the brain. So that's how we actually effectively treat these, and we're able to help these children, and so that they can resume and continue to progress throughout their academic career and achieve whatever they want without any drugs, and so that they can actually do this the natural way, the right way, so that they can become healthy and continue to thrive and pursue whatever they want to pursue. And that's how we address these problems with ADD and ADHD. So if you have a child that has ADHD or ADD, and you've tried medication and you're not happy about giving them those toxic medications for their problem, and you're looking for a better solution, a natural solution, we can at least figure out to see what's going on and see if we can help them. So if you're interested in that, my phone number is 850-785-9372. I would be more than happy to sit down here with you for a consultation. It'll be complimentary. Just tell this front desk office that you watched the video, and we'll sit down for a consultation, and I'll tell you what I can or can't do for you and your child. I want to personally thank you for watching this video. I'm Dr. Tony Salamay, and have a great day.